Hello, I'm Gerard Cush. I'm a foot and ankle orthopedist working at Evangelical Community Hospital. Bunions are an enlargement along the inside of the big toe. They come about for many different reasons. There's certainly genetic issues that play a role, but certainly types of shoe wear, especially tight shoes, can cause issues with bunions. The actual term bunion comes from a Latin term for turnip, because back in the early centuries, when people would look down and see the enlargement along the inside of their great toe, it actually looked like a turnip. The technical term for bunion is called hallux valgus. And that basically describes the hallux, which is the big toe, and it drifts away from the midline, which means valgus. So the combination of bunion and hallux valgus are basically the same from a patient standpoint. Bunions come in all shapes and sizes. There are some really small bunions that hurt people, and then there's also very, very large bunions that don't hurt people. But bunions can occur in many different patient populations. There are adolescent bunions or congenital bunions, so children and adolescents and below the 18 years of age can develop bunions, and that's much more of a genetic problem. But we can also develop bunions later on in life, and that can be either gentlemen and or females, depending on their types of shoe and their genetic background. Of course, we seem to see more bunions in the female patient population, and maybe it's because of the types of shoes that they wear, a little bit tighter shoes, maybe higher heels, but there is certainly a lot of gentlemen that develop bunions also. So bunions, when they get to a point where they're starting to hurt, that's when you should seek treatment. There are non-operative ways to manage bunions. Usually it involves trying to protect the bony prominence. And that first starts with perhaps increasing the width of your toe box in your shoe. The other things that you can look for are if there's any seams within the shoe that may be rubbing on that area. You're going to want to try to migrate away from shoes like that. There are bunion pads and toe spacers, a variety of different things that you can try to alleviate your discomfort with shoe wear. But if and when all these things fail to provide relief of your symptoms, that's when you should take a look at perhaps having something surgically done. Bunion surgery, once you get to a point where it's bad enough to do something, there's a variety of different procedures that can be done depending on the nature of the bunion. So depending on your clinical exam and certainly your radiographs, we take those things into consideration to performing a specific type of procedure. In my opinion, a bunion procedure needs to consider not only the bump, but also the alignment. So that usually involves a combination of soft tissue work in addition to osteotomies, which are big fancy ways to say bone cuts. So a combination of those two remove the bony prominence, which is the bump, but also helps straighten the toe and give us better alignment. These surgeries are usually outpatient procedures, and the surgeon will decide on what type of procedure based off of your specific bunion. There are some smaller procedures, but there's also some larger procedures, and of course they go hand in hand with the nature of the bunion, and as the severity of the bunion increases, usually the type of procedure we do for that also becomes a little bit more involved. But luckily this day and age we're able to do a majority of these as outpatient procedures. During the preoperative process, we'll go through the risks and the benefits of surgical intervention, make sure we understand and we're on the same page in regards to those different issues. And then if and when you're ready to proceed, we usually get you set up for an outpatient procedure. The majority of these are going to be done at our outpatient surgical center, or ASC, here on Evangelical's campus. So once you arrive at the ASC, the nurses will get you ready for the procedure. Very often they'll put an IV in and clean the foot. And after that, we'll discuss with anesthesia the types of anesthesia that you would be able to have. Majority of the time, because it's a peripheral limb, meaning further down into the foot, we can do other things other than general anesthetic. Very often we use a peripheral nerve block in addition to sedation to do the procedure. That's a benefit in multiple ways. One, you don't have to undergo general anesthetic, but the block will also provide long-lasting relief of your surgical pain. So this block may last several hours, up to a day to 36 hours, depending on the type of block they're able to do. That makes the post-operative recovery seem quite a bit better. One of the most common questions I get is, I've heard that bunion surgery is really painful. And this day and age, that shouldn't be the case. With the combination of the peripheral nerve block and some medications after surgery, we should be able to do this in a relatively pain-free fashion, or minimal pain at the very least. After the procedure, you'll be placed in a big bulky dressing, allowed to weight bear through the heel of a special shoe, but there's going to be a lot of elevation and protection for the first couple weeks as we allow the soft tissue to heal and the incision to heal. After the incision's healed, we go through a series of bunion dressings. Those bunion dressings are changed every about 2 weeks by myself and or parts of my team. Both my nurse and my PA help participate in changing those bunion dressings. And then at the 6-week mark, we start removing the bunion dressings, placing a toe spacer, and then start getting you back to routine shoe wear.